As a dental hygienist, we want to assure that all patients are under the best care when in the dental office. We can start by going over the medical history to ensure that patients with special needs are properly taken care of. Patients with IDDM or insulin dependent diabetes mellitus depend entirely on insulin injections. IDDM is a chronic condition in which patients have little to no ability to produce insulin. It's common to arrive in patients during childhood. It's caused by destruction of cells in the pancreatic tissues called the islets of Langerhans. These cells normally produce insulin, which is a hormone that helps regulate glucose levels in the blood.
Insulin-dependent diabetes mellitus has multiple effects on the mouth. These effects include increased risk of dental caries due to salivary hypofunction, accelerated tooth eruption with increasing age, gingivitis with high risk of periodontal disease, salivary gland dysfunction leading to xerostomia, impaired or delayed wound healing, taste dysfunction, and oral candidiasis. Poor control of glucose levels increases all these symptoms.
As a dental hygienist, we must know how to overcome the challenges of our patients diagnosed with IDDM in order to prevent caries, gingivitis, and periodontal disease. Appointments should be scheduled by the severity of caries present in the patient's oral cavity, by applying sealants, giving oral hygiene instruction, tobacco counseling, and keeping glucose levels at a normal range of 80 to 130 milligrams per deciliter in 1 to 2 hours after a meal with under 180 milligrams per deciliter will aid the patient to a healthy periodontium. Hygienists should use aids for dry mouth or aerostomia such as Biotine or sugar-free hard candy. To help prevent patients from having a hyperglycemia episode, the hygienist should pre-treat the patient with medication and possibly a sedative. To prevent the patient from having a hypoglycemia episode, hygienists should schedule the patient in the morning while the glucose levels are high and the insulin activity is low. It is our job to advise patients to eat a healthy meal before the dental appointment. As a dental professional, we are responsible for having a source of glucose in the office, such as fruit juice or glucose tablets to prevent insulin shock. Hygienists should establish circulation, airway and breathing, call EMS, and put the patient in Trendelenburg position if insulin shock were to happen. Patients should be given glucose orally or have a dentist administer dextrose or glucogen.
Insulin-dependent diabetes mellitus patients' greatest challenge to obtaining dental care is ensuring their glucose levels are within the normal range. This minimizes effects on the oral cavity as well as prevents hyperglycemia and hypoglycemia. These patients need to eat a meal and take their usual medications prior to dental treatment. The type 1 diabetic patient needs to monitor oral disease progression, oral hygiene, and diet. Patients must also stay alert of sores in the oral cavity due to poor healing.